Drug abuse and addiction among primary and secondary school students has been of growing concern lately. Between 2020 and 2023, data from the National Anti-Drugs Agency (AADK) indicates a disturbing trend of escalating drug addiction cases among school-going students in the country. This issue highlights the urgency for stronger preventive measures and social awareness. The problem, as reported, drug abuse and addiction among school students involve from as young as 11 years old being exposed to and addicted to drugs. In 2020, there were 10,456 drug abuse cases among primary school students, and this number rose to 12,755 cases in 2022. In secondary schools, the story is alarmingly worse, where those implicated follower secondary students increased from 32,867 in 2020 to 37,321 in 2023, and for upper secondary students, the situation is even more revealing, from 42,758 in 2020 to 55,855 in 2023. The causes for this problem are that the drugs can be obtained more easily, influence of the friends, lack of knowledge about the harmfulness of drugs, and individual or family problems are among other problems which contribute to the problem of substance abuse. The influence of social media and lack of supervision in some environments also may lead to early experimentation and dependency on drugs. In this issue, there are multiple parties that involve in both emergence and response. The AADK plays a central role in monitoring, preventing, and rehabilitating drug users. This is the responsibility of the Ministry of Education and the school boards in identifying the at-risk children and promoting educational campaigns. Family and communities are among the primary stakeholders who are responsible to shield and emotionally support young people. The police is also involved in the supervision of the drug chain. The effect of it is devastating. It damages students' emotional and physical well-being, interrupts their learning, and leads to higher levels of criminal offending. This is also a strain on healthcare and rehabilitation services, and by extension, the country's future of its workforce and productivity. It is also can cause of increased social instability and loss of potential among the youth. The consequences will primarily be faced by the students themselves, who risk long-term health problems, poor academic performance, and limited future opportunities. Their families may suffer emotional and financial strain. Additionally, if the issue is not addressed, the government, especially AADK, could face criticism for ineffective prevention strategies, and society at large will risk the long-term consequences of a generation affected by substance abuse. Drug abuse among school students is not just an individual issue but a national crisis. Stronger prevention programs, family involvement, and community cooperation are necessary to stop this trend before it worsens.
NADA, which stands for the National Anti-Drugs Agency, plays a very important role in addressing drug abuse in Malaysia through strategic and comprehensive planning. It operates under the Ministry of Home Affairs and is the main agency responsible for coordinating anti-drugs efforts nationwide. NADA's planning can be divided into several levels. The first one is strategic level. At the strategic level, NADA collaborates with the international agencies such as Singapore Centre Narcotics Bureau. This helps in exchanging ideas, improving enforcement strategies, and also strengthening diplomatic ties. Second one is collaborative efforts. NADA also works closely with the Ministry of Health to provide treatment and rehabilitation. This include behavioral therapy, counseling, and support services, and to focus on long-term recovery and reintegration into society. The third one is short-term operational plans. For short-term plans, NADA runs awareness programs in schools and universities. For example, programs Pintar 2.0, Shields, and Tomorrow Leaders. They also carry out public campaigns such as the National Day Against Drugs, also known as HADK. For long-term efforts, NADA works together with the PDRM, Royal Malaysian Police, to combat drug trafficking, dismantle syndicates, and strengthen border controls. The fifth is all of NADA's efforts are guided by the national policies, which focus on 4 main areas, which is prevention, education, treatment and rehabilitation, enforcement, and international cooperation. Apart from planning, NADA's Management Service Division, which is the support division, also performs important functions to keep everything running smoothly. Personnel management, which is the first one. This includes handling staffing, staff welfare, and the organizational structure. Second one is human capital development. They also offer training programs and manage information resources to support staff development. And for financial management, this division prepares the annual budget, monitors expenses, and ensures financial accountability. So for general administration, they manage agency assets such as buildings and vehicles. Project development, they allocate the development budget and monitor how well projects are being implemented. And for the Information Resource Center, this center helps collect and manage data so that decisions can be made based on accurate information. Okay. Lastly is the Quality Assurance Unit that ensures all of NADA's activities meet high service standards. Overall, NADA's structure planning and support function shows how serious Malaysia is in fighting drug abuse from all angles, which is like prevention, treatment, enforcement, and even international cooperation.
In organizing, I'll be sharing how Malaysia, through the National Anti-Drug Agency or NADA, is working to manage and prevent drug abuse in our country. First, we start with preventive education. NADA runs awareness campaigns in schools, colleges, workplaces, and communities. These campaigns use talks, exhibitions, social media, and interactive events to educate the public, especially young people, about the dangers of drug use and the importance of living a healthy, drug-free life. Second, enforcement plays a big role. NEDA works closely with the Royal Malaysian Police, or PDRM, to fight drug trafficking and distribution. Through joint operations and sharing of information, they aim to reduce both the supply and demand of drugs in Malaysia. Third, we focus on treatment and rehabilitation. NEDA operates Cure and Care Rehabilitation Centers, also known as CCRCs, and clinics. These facilities provide detox programs, personal and group counseling, skills training, and support to help former addicts reintegrate into society. A great example is the CCRC in Sungai Besi. One youth who struggled with addiction was brought there. He received a medical help, learned job skills, and eventually returned to society with support from the center. His recovery also started with early intervention through school awareness programs. Lastly, NADA doesn't work alone. They partner with other government agencies, NGOs, and international organizations. They also carry out research and data collection to track drug trends and make sure their programs stay effective and relevant. In conclusion, Malaysia's strategy is not just about punishing drug offenders, it's about prevention, support, and giving people a second chance. Together, through education, enforcement, treatment, and collaboration, we move closer to a drug-free and healthier Malaysia.
Decision making is the process of choosing the best action to solve a problem. It is a key part of managing any organization. Every decision uses important resources like time, money, and effort, so it must be made wisely. Good decision making is important because it helps solve problems more effectively. It builds trust, improves motivation, and creates a more organized workplace. On the other hand, poor decision can lead to confusion, stress, and failure. For example, the National Anti-Drugs Agency, or NADA, uses a special program called iPulih. This program helps provide the right treatment and rehabilitation for each client based on their background and needs. Another important part of decision making is risk management. Risk management means identifying possible dangers and planning ways to prevent them. It helps organizations avoid unexpected problems and stay successful in the long term. NADA shows strong risk management by organizing programs like the International Day Against Drugs. This event spreads awareness and brings people together to fight drug problems in the community. There are also two main strategies used in decision making. The first strategy is collecting data. This means gathering information from reports, surveys, or interviews and organizing it into charts or summaries. It helps leaders understand the situation and plan better for the future. NADA collects data every year about drug abuse cases. This helps them know how serious the problem is and what actions to take next. The second strategy is taking direct action. This means solving problems quickly before they get worse. People who take direct action often become strong leaders because they don't wait for others to fix the problems. NADA used this strategy by organizing awareness campaigns, talks, and exhibitions. These events teach people about the dangers of drug abuse and help stop problems before they happen. Another type of decision made by organizations is strategic decision making. These are long-term choices that help shape the future. For example, NADA created the National Drug Policy Action Plan. It focuses on prevention, treatment, enforcement, and working with the community to achieve a drug-free Malaysia. In conclusion, decision making is an important part of every organization. It helps solve problems, manage risks, and plan for a better future. NADA is a great example of how good decision making can protect and support community.
What control done for managing the issue by ministry? First, the ministry through AADK uses an integrated and strategic approach. This includes enforcement, treatment, prevention, and rehabilitation. AADK works under the Ministry of Home Affairs to ensure that issues are tackled from all angles. Second, in 2022 Direction Plan 10 strategy year introduced. The strategy focuses mainly on rehabilitation, preventive education, law enforcement, and all efforts are made to be structured, targeted, and measurable. Third, collaboration with stakeholders. AADK work closely with Royal Malaysian Police, PDRM, and NGO. For example, joint operations have led to major drug seizures worth millions of ringgit. One notable case is operation over 4 million ringgit in drug, including 62 kg of shabu seizures, as reported by Raja Naraina 2023. Fourth, shift toward rehabilitation, from punishment to community-based recovery. A new law replaced the old 1983 Act of Drug and Substance Abuse. Current effort now focus on vocational training, aftercare, and reintegration through participant centers. Now, if we look at how this action relate to management concept undertaken by ministry in overcoming the issue. First is they identify the problem. Second, they analyze drug trends and target groups. Third, they generate alternatives such as enforcement, education, and rehabilitation. Four, they evaluate pros and cons. Five, they choose the best mix of strategies. Six, they implement with agency and programs. 7. Finally, they monitor results and make improvements.
In conclusion, drug abuse is a serious national issue in Malaysia. NADA play a key role in rehabilitation, prevention, and enforcement efforts. Among it, strengths are strong government support, sufficient rehabilitation center, and good cooperation with community. However, weaknesses include a lack of personal and rural area, the stigma faced by former addicts, and prevention campaigns that fail to attract young. There are opportunities for NADA to expand its use of social media and collaborate with NGO and mental health experts. Drugs faced include increasingly advanced drug, negative social media influence, and community resistance to rehabilitation center. It recommended that NADA invest funding, add more staff, and improve digital campaign to better reach young people.